cancer or malignant, ulceration hota hai on top of that wound. It can come at any age. There is no specific age when with age is related. It can happen in younger ladies, it can happen in younger girls, adolescent girls, 25 to 35. Any of them it can happen. So generally the breast is, one breast will be so big, the other will be normal size. Now that wound looks very dangerous.
You are watching Surgery Simplified, shastrakalasaralshabdomein.
Hello everyone, welcome back to Surgery Simplified, shastrakalasaralshabdomein. Welcome back, doctor.
Thank you. Namaste.
So, पिछले episodes में we spoke about benign
Breast
breast
disease.
disease. Oh, I got that right. Okay, so are there any other conditions to do with breasts?
Yes. So benign का उल्टा or opposite is cancer or malignant. So we say malignant, benign, right? Or non-cancerous, cancerous. So today I'm going to talk about two other conditions of the breast. One is not full out cancer, but it has the potential to do what is called as local recurrence. That means you remove the tumor and it is likely to again grow there. So
Relapse होने के chances.
relapse होने का chance रहता है. So that is called Cystosarcoma Phyllodes. That is the technical word. We'll come to that. And the second is cancer of the breast. So Cystosarcoma Phyllodes, what is that? Basically, it is the fibroadenoma I told you is like 2 to 4 centimeters. If you remove it, if it grows beyond 4 centimeters. This is a large tumor. Almost the entire breast, it will be like 8-10 centimeters or 15-20 centimeters. Big, it will be like a football, a small football, that big. It can grow to any size. And sometimes when it grows, it stretches the skin and the skin gives way and forms a wound on top. Ulceration hota hai on top of that wound. So generally the breast is, one breast will be so big, the other will be normal size. Now that wound looks very dangerous, but you can remove the whole wound and you don't need to remove the breast. You can only remove the wound.
Okay.
But as I said, that it has a potential to recur. Now if it recurs very often, then you have to go in for a removal of the breast along with the tumor. So this is known as Cystosarcoma Phyllodes. It is not very common and it can come at any age. There is no specific age when with age is related. It can happen in younger ladies, it can happen in younger girls, adolescent girls, not very adolescent, but say 16 to 22, that age group, the Fibroadenoma group or the Fibrocystic disease group, 25 to 35. Any of them it can happen. The main advantage or the main good thing about it is we don't have to remove the breast, at least not at the first stage. Only if it recurs. Even if it recurs, we can again remove it. Okay, so breast doesn't have to be removed. Then comes the carcinoma of the breast. Carcinoma of the breast is basically one of the commonest carcinomas worldwide in women, and it's increasing in India also.
Okay.
Now there are certain factors or what you call it, causations. One thing is there is a BRAC gene, BRAC 1 and 2, breast cancer gene 1 and 2. If that gene is present in somebody, there is a very high chance of developing cancer. So it's genetic partly.
Okay.
So we generally ask a person who comes with symptoms or a tumor in the breast, whether mother had cancer, maternal aunt had cancer, cousin sister on the mother's side had cancer, her sister had cancer. Very often, not very often, but quite often, you find that somebody in the family on the mother's side has had cancer.
Okay.
Grandmother, mother, maternal aunt, cousin sister from the mother's side or own sister, they have had cancer. Which indicates to us that this might be a case of cancer. The second thing, people who are overweight, have diabetes, and their body mass index is more, tend to develop cancer breast. The third thing is a Western diet. Okay, so again that. And the last thing is, as I said in the earlier episode, that if the breast is not subjected to the purpose for what it is, which means pregnancy, lactation and feeding, then also it can contribute to breast cancer. So the reason for this is not known, but if you can see in the West where it was very common, the age of marriage was very high from many years. Now it is increasing here. Girls don't get married fast. If they get married also, they don't want to have children very fast, or sometimes they opt not to have children. With the result that even if they are married, the breast is not exposed to the lactational phase. Apparently, lactation is very protective against breast cancer. So even if you have one child and you breastfeed the child, it is the chances of developing breast cancer are reduced compared to if you don't at all have a child or feed the child. Okay, so this is about this. And another one reason is oral contraceptive pills. Now again, girls who are not married or have live-in relationships are using oral contraceptive pills as a form of contraception. Now, prolonged use of oral contraception pills is also one of the etiological factors of cancer breast. So all the new age things, late marriage, no child, no lactation, taking OC pills for longer periods of time, a diet rich in polyunsaturated fats or saturated fats, stress, all these things together can cause cancer breast, and that is why the incidence is increasing. Now coming back to the clinical symptoms, the most common symptom is a lump in the breast. Now the question is whether this lump is benign or not benign.
Right.
As I told you, a fibroadenoma is very mobile. It moves very easily in the breast.
Right.
It is non-tender and there is nothing which, there are no skin changes. In a cancer breast, depending upon at what stage you see, it could be a lump which is anything between 2 to 5 centimeters, but it will not be mobile. It will not move. If it is more advanced, it will get attached to the skin. The skin will be attached to it, or it will be attached to the muscle below, indicating an advanced stage of cancer. The lymph nodes in the axilla, they get enlarged. So if you find the lymph nodes in the axilla enlarged and a lump, then obviously you can put two together and say that this could be a cancer, right? So the first step is of course to do an ultrasound. There is another test which is known as mammography.
Okay.
It is like a Xerox of the breast. So you know the mammography machine like a Xerox machine, and the picture comes just like a black and white photograph of the breast. So there is a special image on the mammography which shows either ... or speckles of calcification inside the lump. That suggests, so if the lump is not well defined and it is like star shaped, it is moving here and there into the surrounding tissue with specks of calcium all around, or spicules of calcium like rays of calcium, sun ray appearance like that. That kind of appearance on the mammography again is suggestive of cancer. So after ultrasound and mammography, the third test would be to do a FNAC, which I told last time, fine needle aspiration cytology. But now the difference is, if the fine needle aspiration does not show cancer, it is still necessary to do a biopsy.
Okay.
Because if the cancer is only in one part of the breast, in the tumor, and the needle has missed that, it is possible that cancer is still there. So we do excisional biopsy. We excise the lump and send the whole lump for biopsy. There is one option. Sometimes you can also do in one surgery itself removal of the lump, frozen section. Frozen section means what? You call the pathologist in the operation table or operation theatre, and he takes the mass and he freezes it and makes sections of it and gives you the histopathology report there and then. within say 15-20 minutes while patient is under anesthesia. If he says frozen section positive, you proceed with the cancer surgery.
Okay.
It saves one anesthesia. It saves one admission. So if your clinical impression, mammography impression and the ultrasound impression is suggesting to you that this is likely to be a cancer, then it is justified in doing a frozen section or arranging for it, and in that surgery itself proceeding with the next stage of the cancer treatment. Now again, very important is tissue diagnosis, which we already discussed. Staging. Now there is again 4 stages. First is the size of the tumor itself, whether it is less than 4 or larger than 4 centimeters. Second is frozen section is a method of doing the histopathology or tissue diagnosis in the operation theatre, so that you can proceed with the definitive surgery. That means whatever is required to remove the cancer itself.
Right.
Okay. In breast cancer, like other cancers, there is stage 1, stage 2, stage 3 and stage 4. Stage 1, if it's a small tumor less than 2 centimeters. Stage 2, if it is between 2 and 4 centimeters. And if the nodes in the axilla are mobile and less than 3 nodes. Beyond this, it could be the tumor is big, or the tumor is small but it is attached to the muscle, or it is attached to the skin, or there are more than 3 lymph nodes, or the lymph nodes are enlarged and stuck to the vessels below. Any of the other signs are generally considered as advanced cancer.
Okay.
It could be locally advanced or it could be distant advanced. So if the lymph nodes in the axilla are advanced, it becomes stage 3. If the lymph nodes in the neck are, from here it is spread to the lymph nodes over here, it becomes stage 4. Or any spread in the liver or in the bones or in the lungs, brain, anywhere. So breast cancer basically first grows in the breast, then spreads to the lymph nodes, and then it spreads to other areas. So first 2 stages is good prognosis. And if the lymph node, if the cancer is small in size, you can even do breast conservation surgery.
Okay.
So you can do a wide excision of the breast tissue along with the tumor. And if 1 or 2 lymph nodes are involved, you can even remove the axillary lymph nodes separately and preserve the breast. But if the breast tumor is larger in size or it is locally advanced, then you have to go in for a radical mastectomy.
Radical?
Mastectomy. That means you have to remove the whole breast right down to the muscle along with the lymph nodes. So this is about the surgery. Other modalities of treatment in breast cancer are chemotherapy and local radiation. But there is one more important aspect of breast cancer, because it is related to hormones. There is a hormonal therapy also which is available to patients. So the cancer surgeon will decide depending upon the grade of cancer. That means when you do the biopsy, you can see whether it's a high grade cancer, moderate grade or low grade cancer. So the grade, then the stage, that means what is the size of the tumor and what is the status of the lymph nodes. Based on these 3 things, he will decide what is going to be the total plan for that patient. Is it only going to be surgery? Is it going to be surgery plus radiation? Is it going to be surgery, radiation and chemotherapy? Is it going to be surgery and chemotherapy? And is it also going to be hormonal therapy? In hormonal therapy, commonest drug which I told also for fibrocystic disease, tamoxifen. Tamoxifen is an anti-estrogen, but it somehow has an effect on breast cancer, and generally it is given as an adjunct along with other treatment for a period of 5 years. Because it's
like
a tablet.
Supplement.
It's a tablet which you can take, not as a supplement, as an adjunct, so that even the hormonal part is taken care of. And prognosis in breast cancer is completely dependent upon the stage. If the axilla is not involved, the prognosis becomes much better. If the axilla is involved, or if it is locally advanced and the axilla is involved, then the prognosis is less favorable. And one more thing is that once the patient is deemed cured, you can go for breast reconstruction. So plastic surgeons, either they can put breast implants they can tattoo almost like a nipple. Sometimes they can recreate a nipple, taking skin from the opposite nipple, growing it like a stem cell in a laboratory and make a nipple, and then you can put it, which will function like a normal nipple. So things are very advanced now. You can have almost cosmetically, you can recreate a breast, not out of breast tissue, but out of a prosthesis, but the skin on top and the nipple can be recreated to look like a normal nipple. So therefore, psychologically, when a younger person, what I meant is, say somewhere in the age of 35 to 45, that's quite a lot of people in that age group do get cancer. These people psychologically are affected if they lose their breast.
Right.
So it is important that once the patient is deemed cured and all the treatment is over, that they can go in for the reconstruction or cosmetic procedures which will give them almost normal looking breast, which is looking like the other breast. So psychologically they'll again feel like they're a complete person. So today there are lots of advance in breast cancer therapy, and just because you're diagnosed with cancer doesn't mean it's the end of the story.
Right, right. So earlier there was a taboo also, I believe, but now because there's a lot of more awareness going on around breast cancer, it is just that you get the right treatment and then you're deemed.
Yes. So basically there are lots of NGOs and other institutions and who are doing a lot of awareness.
Right.
So the best thing is to do self-palpation. Whenever you are having a bath and if you find a tumor at any time, the best thing is to go and consult a cancer surgeon, breast surgeon, whoever, at the earliest, so that a diagnosis can be made. Putting your head underneath and saying that it will go away is not going to work. It is only going to grow, and you will then end up with something much more in the form of removal of the entire breast or a radical surgery, which could have been avoided if that was tackled at an earlier stage. So again, to take home message, I would be very happy if this episode, lot of ladies listening in, take the cue to go to a cancer surgeon or a breast surgeon at the earliest and get their lump diagnosed and treated.
Right.
I would say, even if a few of them do that, and we can avoid them losing their breast and going in for more therapy, like again chemotherapy, radiation have side effects. You lose your hair and there's vomiting and things like that. It's not a very pleasant form of therapy. So you can avoid that. It is best to do when the thing is confined inside the breast in a small size. Abroad now, what is happening? They are doing a lot of screening programs. So they do mammography and screening of most of the people who are related, female relations of a cancer breast patient. So they are able to pick up cancers even before they have become a tumor. That's called carcinoma in situ. It's very small lump. So they are able to now do a lot of breast conservation therapy. Over here, there is not that much of awareness as yet, but still we are trying from our side.
Okay, well, thank you so much, doctor. So this episode was very, very informative, because now the cases of women getting breast cancer is huge. So if at least our informative episode reaches out to a larger audience, especially women, then there is something that we have done good.
Yes, I think so.
So if you have any questions regarding this episode, please put it in the comment section, and we'll be more than happy to get back to you. And if you have any further suggestions, for doctor to discuss on any other topic done so far, then do let us know on that as well. Please like, share and subscribe to our channel. Hit that bell icon for notification, and stay tuned for more informative videos on surgery. Thank you so much.